Dear friends, welcome to our channel. On today's program, I would like to discuss allergies and their treatment. Allergies come in various forms, ranging from common allergic rashes like pollen allergies to newer types such as Quincke's edema, which is the most recognizable symptom of allergies. Swelling of the nasal mucosa leading to nasal congestion and allergic rhinitis is also a well-known manifestation. Allergic rashes can appear on the abdomen, face, and elbows, while redness of the eyes indicates allergic conjunctivitis. These allergic symptoms are typically identifiable and do not pose diagnostic challenges. However, there are unexpected manifestations of allergies that even doctors may not always recognize. For example, aphthous stomatitis, the occurrence of painful ulcers in the mouth and on the tongue, can sometimes be a result of allergies. It is often treated unsuccessfully for a long time without realizing its allergic nature. Other allergic symptoms can include ear congestion, decreased hearing, breathing difficulties, certain types of headaches, and a feeling of pressure or swelling in the head, accompanied by nausea or a sense of something being leaky. Eczema is another condition that can be challenging to treat, and few people are aware that it can also be an allergic manifestation. Recognizing these symptoms and determining whether they are of allergic nature or not is relatively simple. By taking anti-allergy medication for 3 to 4 days, one can observe if the symptoms decrease or disappear. If the symptoms improve, it confirms that they were caused by allergies. However, if the therapy does not show any effect, it is necessary to explore other potential causes. Now, let's transition to the general treatment of allergic diseases in modern medicine. There are two main approaches. The first approach involves taking anti-allergic medications when allergies occur. The second approach aims to identify the specific allergen through various tests and then recommends avoiding contact with that substance. In some cases, medication may also be prescribed. However, I am not a proponent of either of these approaches. It is essential to understand that fighting allergies solely by taking pills or avoiding specific allergens is not always sufficient. Avoiding contact with one allergen does not guarantee immunity to other substances in the long run. It is crucial to recognize that most allergic symptoms, such as rashes or a runny nose, are just the visible signs of an underlying issue. Treating the symptoms alone is not enough. The focus should be on addressing the root cause of the disease. Therefore, it is necessary to target the source of allergic reactions to achieve long-term relief. And I hope you realize that allergy pills alone do not provide a cure. Once a person stops taking them, the symptoms may return. To truly address allergies, it is crucial to understand their nature and why they occur. Allergies, in essence, involve an overactive immune system that reacts aggressively when exposed to certain substances. To comprehend why this happens, consider the absence of allergies in indigenous populations living in primitive conditions, such as those in the Amazon Delta or Africa. Scientific investigations have shown that these communities have minimal allergies, at least until they are exposed to modern civilization. Interestingly, our ancestors from 200 to 300 years ago also experienced fewer allergies. However, since the second half of the 20th century, the number of people suffering from allergies has skyrocketed. While one might initially attribute this to worsening environmental conditions, it is important to delve deeper into the issue. One paradoxical explanation could be the increased emphasis on cleanliness. While cleanliness is generally beneficial, the excessive use of chemicals in cleaning products, detergents, shampoos, and shower gels has become commonplace. Many people wash themselves multiple times a day using chemical-laden products, unaware of the potential consequences. Even young mothers often wash their babies 2 or 3 times a day using baby shampoos that contain chemical ingredients. Consequently, they are left wondering why their babies develop allergies. It is not to suggest that one should refrain from maintaining personal hygiene. Instead, it is advisable to reduce the use of chemical-laden products and opt for natural alternatives whenever possible. Additionally, caution must be exercised when using laundry detergents. Modern washing machines typically clean clothes effectively without excessive use of detergents. Therefore, it is wise to minimize the amount of detergent used during each wash. Similarly, reducing the use of chemical dishwashing detergents can also be beneficial. Moving on, the second major cause of the allergy surge is the development of the chemical food industry. The widespread use of chemicals in our food supply has made it nearly impossible to find completely natural and chemical-free options. Nevertheless, it is vital to make an effort to eliminate or at least minimize the consumption of the most harmful products. For instance, avoiding chips, chewing gum, and various chemically processed candies packed in bags can be a step in the right direction. By being mindful of the ingredients in our diet, we can take control of our allergies and strive for a healthier lifestyle. If possible, it is advisable to exclude canned and processed convenience foods, such as smoked meats, bacon, brisket, ham, and carbonates, from your diet. These meat products are often heavily treated with chemicals, preservatives, and additives. It is best to avoid sausages and frankfurters as well, as they are often unclear about their ingredients and heavily preserved. Furthermore, it is important to reduce the consumption of salted and smoked fish, as they can contribute to allergies. Instead, opt for fresh or steamed fish preparations. In addition to food choices, it is crucial to eliminate harmful chemical drinks like colas, Fanta, unnatural juices, and packet juices from your diet. These beverages not only contain high levels of sugar but can also negatively affect the function of the pancreas, increasing the risk of developing allergies. While some doctors may have different perspectives, I have observed that individuals with elevated blood sugar levels or compromised pancreatic function tend to experience allergies more frequently. Therefore, it is recommended to cut down on consuming sweets, sugar, and the most harmful chemical drinks. Instead, choose homemade beverages like chamomile or linden blossom tea, which have mild anti-allergic effects. However, it is important to be cautious if you are allergic to these herbs. I want to provide some non-conventional tips for dealing with allergies and reducing the reliance on allergy pills. One method is to try using calcium gluconate tablets, which were traditionally prescribed for allergies. However, it is essential to read the instructions and check for any contraindications before using this medication. Taking calcium gluconate tablets for 2 to 3 weeks may help alleviate or prolong relief from allergies. Another approach is to cleanse the body of allergens using enterosorbents, which are substances that cleanse the intestines. Activated charcoal, polyphenol, and polysorb are popular enterosorbents. It is advisable to take them for 3 to 4 days, with breaks of 2 to 3 weeks in between, to avoid constipation. When it comes to herbal remedies, some plants like yarrow have shown anti-allergic properties. You can prepare an infusion of yarrow and consume it for 3 weeks. However, it is important to note that not all herbs have proven anti-allergic effects, so it is crucial to research and consult with a healthcare professional before using any herbal remedies. Please keep in mind that the topic of allergies is extensive, and we will cover more aspects in future programs. We encourage you to leave your comments, share your experiences, and let us know if our advice has been helpful. Thank you for watching. Have a great day, stay healthy, and don't forget to subscribe to our channel.